Hi, I'm Dr. Delrose from North River Dental here in Ellington, Florida. People sometimes ask me, what should you do if you crack a tooth? Well, it all depends on how it cracked. If you're out at dinner and you're having a wonderful martini and you bite in the olive and there's a pit there and you crack a tooth and you have pain, you need to get in immediately. Most likely that fracture or crack may be into the nerve of the tooth. If that's the case, then there's different ways that we need to take care of it. But that could set up a really bad infection and you don't want to get all swollen up just from having a martini. You can crack teeth other ways too. Sometimes dentists put very big fillings in teeth. Fillings do what they say. They just fill in, they don't add a lot of strength. And over time, they can act more like a wedge than a filling because they're just filling in, and as you bite down, they can cleave off part of the tooth. If you're not having discomfort when that happens, you think, well, it's not a big deal, I'm not going to worry about it. But you're exposing the inside of the tooth, the dentin, and that could get cavity, and once again, over time, that could cause a terrible infection, which in turn causes a lot of pain. If you do have large fillings and they do crack and fracture, we can fix the tooth before you have any of that discomfort. And then sometimes you may be just talking and having a good time and eating with your friends and laughing and bite a fork and chip a little front tooth and a little of the enamel falls off. And it's not a big deal. And you can look at it and aesthetically it may not bother you or anything, but always have it checked by a dentist. What we would do is we would take an x-ray of it to see what it looks like, and we may take another x-ray in about 6 to 8 weeks to make sure the nerve wasn't damaged. So if you crack a tooth and you're not having any discomfort, still call your dentist and get in right away with it. If you crack a tooth and you're having discomfort, call the emergency line, get on an antibiotic, and get in right away.